Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and I just want to address a pet peeve of mine, and that is when people say Medicare Part A is free or refer to Medicare Part A as free. It is not free. We pay for it through payroll taxes our entire working lives, and the only way people earn premium-free Part A is paying in long enough or being married to someone long enough who's also paid in the required years. You may be more familiar with FICA, those are the payroll taxes, and those taxes support Social Security and Medicare Part A. So most people pay 1.45% of their gross check toward Medicare. Higher income Americans pay 2.35%, and there's no limit to that. You pay it and you pay it. Unlike Social Security, at a certain income level, you've paid as much as you can for the year. So just to let you know, the vast majority of people do qualify for premium-free Part A, but there are some people who marry a foreigner who's never been part of the paying into the United States payroll in any fashion. And there are very, very wealthy people who didn't have to work. Those are at least two categories. But so the vast majority of people do qualify for premium-free Part A, but it is far from free. So the cost of Part A, if you don't qualify for premium-free Part A, is $505 a month this year. And you do need to sign up at 65 or you may face a penalty, unlike people who work beyond age 65 and are eligible for premium-free Part A. They won't ever pay a penalty on Part A. And there's also a lower amount. For example, once we had a client who had a trust fund and she didn't need to work. She was married to someone who did pay payroll taxes, but the marriage didn't last quite long enough. So in that kind of situation, this year, someone would pay $278 a month. This came up because there was a Kaiser Foundation article that featured the daughter of a woman who had recently passed away. The woman had unfortunately, the mother had not enrolled in Medicare Part B, and before she passed away, she had an air ambulance trip that was very costly that would have been covered by Medicare Part B had she enrolled in Medicare Part B. And the adult daughter was wondering, why are there separate parts of Medicare and one is free and one is not? Well, nothing's free. They are distinct programs. That is a source of great confusion, and they're funded differently. But just wanted to clear up the fact that we pay dearly for our Medicare Part A, so please don't call it free. That's it. Take care. Thank you for listening. Have a good one.